Hi, everybody. I'm super excited about tonight. I think there's a lot of people watching who may be on the physio and chiro side of things. And then there's some that may not, so they may not know who I am. So I'll kind of introduce myself first, and then I'll have Dr. Broadhurst talk about herself a little bit too. Our hope is to go through her brand new book, which I'm super excited and I've been reading and I'm really, really loving. So we're going to talk about that and then maybe delve into some of the new legislations that are being proposed in Ontario. Definitely some stuff that's going on in the States and California, and see where that leaves us. So I'm Dr. Danielle Anderson. I went to the University of Guelph for my biosci undergrad, and then went right into the Ontario Veterinary College where I graduated in 2002. I practiced small animal medicine until most recently when I stopped doing any regular medicine and just focused on rehab and pain management. In 2013, I finished my rehab certification through the University of Tennessee, and then did my acupuncture certification through Curacor in Colorado in 2016. I have helped with Michigan State University, the vet rehab rotations virtually recently, and definitely help a couple times a year with the medical acupuncture for veterinarians, intensive exams. So that's my story. I currently own SOAR Veterinary Services in Ontario, Canada, which is a rehab and pain management referral practice. So we are standalone. We are not associated with any other veterinary hospital. And we've been there for 5 years now and going strong. There are myself, 2 tech CCRPs. I have a vet CCRP who comes in part-time for me. We've had a CFT, so a fitness trainer as well working for us, and then some assistants. We've hosted physiotherapists who have come and done their hours with us. So we've definitely seen a lot. I've been an associate, I've been a student, I've been a locum, and now I'm an owner. So I have a large perspective on a lot of different things. And so that's me. And this is Dr. Broadhurst, who, if you guys have never been involved in online pet health with Megan Kelly, I highly, highly, highly recommend that you go at least start by joining the Facebook sites and follow her. There's some great communication worldwide amongst veterinary rehab professionals, and it's a great fit. That's where I met Michelle. And we kind of connected, and I was like, oh, let's do some stuff together. So here we are, and welcome, Michelle. I'm super, super excited about this.
Thank you so much. It's so nice to chat with you. So I'll just give everybody a very, very short history about me. I am a certified animal chiropractor. I'm a human sports physician, acupuncturist. What else am I? CCRP, and I'm missing something, but that doesn't matter. So I am originally from South Africa. I had my own practice for 17 years, and I specialized in stud and thoroughbred racehorses as well as canines. So I have a huge, huge, big heart and passion for myofascial pain and the integration of structural and functional medicine together, because I really think that that is where the core of what we do and the essence of what we do is really established. So functional neurology is really my jam. I'm a little hesitant sometimes to call myself a pure chiropractor, just purely because it's not what people think it is. So we're not just taking a hypermobile joint and adjusting it and changing things on a structural basis. We are changing things on a neurological and a functional basis too. And myofascial pain is something that's very, very new in the veterinary world. It's been, especially fascial pain, has not been addressed very much. And that's really where my passion is, because functional medicine is really important, and dealing with negative feedback loops and descending pain pathways and changing things on a functional level to create a structural and biomechanical change in pathways is really where I see a lot of our manual therapy going.
So how did this book come about? Because is your husband involved in this book too? I know your husband's a chiropractor as well.
Yeah, he illustrated it.
Oh, really?
Yeah.
Yeah. Well, the illustrations are fantastic. I wonder if we can show some stuff at the back, but Dr. Broadhurst goes through some really, there we go. Um, each muscle group and talks about myofascial trigger points, and it is it covers absolutely everything, right? It covers your anatomy, it covers your why are we doing this,
Mm-hmm.
some of the research behind all of it. It covers laser therapy. You talk about regular acupuncture versus dry needling. And truthfully, I do acupuncture, but I don't do a lot of dry needling. And I'm, watching this and reading this and going, I need to be doing more dry needling. And so tell me how this came about. Like how long was this in the works that you were working on it?
Well, when I was in South Africa, I had such a busy practice. I was working 6 days a week and 16-hour days. And I had all this knowledge. I had all this stuff. And I had all this like empirical evidence from my practice that I never, ever, ever, ever thought about having a book, ever, because I never had the time to write one. And then I moved to Maine, where it's winter for 8 months of the year. And I kind of changed tack a little bit. And I was doing a lot more kind of human acupuncture because of the legislation in Maine and chiropractic. And my husband said to me one day, why don't you've got all of this stuff, all this stuff. Nobody ever does it. Why don't you write a book? And I was like, I'm not a writer. Like, I've never written anything more than a shopping list. Like, why would I do this? But I'm kind of at that point in my career where I feel like I don't, when you graduate from college, you think you know everything. And then within the first 2 years, you realize you know nothing. And then after 5 years, you think you know something again. And then at 8 years, you know nothing again. And you go through these things. And little by little, you chip away at your ego until you go, wow, I've got something to learn from everybody. And that's really what I'm trying to bring to the table. I love having a bunch of textbooks on my shelf, but when practice is busy, I really grab my little tiny reference book when I'm like, oh crap, I've got something with a neurological disorder. I've forgotten which pathway this works off. I just need a 2-minute refresher. I can't sit with a 700-page book and go through all the mechanisms. I need an answer now so I can apply it to my patient. So that is really how the book is designed. It's not meant to be a huge textbook. It's a manual, really, and it's a reference book for people who are in the field treating with myofascial pain. They're coming across some weird stuff. They're not quite sure what they're doing or where it's coming from or whatever, and that's really what it is. It's like, oh, maybe it's not the stifle, maybe it's actually the quad, or maybe it's the sartorius or whatever. I'm going to quickly pick this up, and this may actually be able to help my patients. And especially myofascial dry needling is very quick. It's very efficient. And in any kind of medical profession, we are selling time and efficacy, right? And it is one of the things that I have found in my practice that has been the most efficient and cost-effective, efficient, and like least time-consuming way of changing a biomechanical issue really fast. So that's why I wanted to share it with the world. The equine book's coming out at the end of the month. So that's another one that's on the books, but literally, yeah. So yeah, I'm kind of changing tack. I really want, I have no issue about giving away my IP, and I want people to be better. I want dogs to be better. And I want everyone to start thinking outside the box and change perspectives a little bit, and increase what you have in your toolbox. Because if you only have a hammer, everything looks like a nail.
Right. And we just got a question about whether it's a good reference for a vet student. Oh my gosh, yes. And if anything, like this book needs to be in the right hands as well. So, you don't want someone without any training and preferably with some of these certifications, right? To use this and say, I'm going to just start dry needling animals.
No.
They need more training than that, but as a reference for student, you don't get this stuff at all in vet school. They barely get rehab in vet school. So
Mm-hmm.
to have this and then maybe plant some seeds and give you some extra information on how to do your physical exams, and maybe it'll encourage them to take those certifications, right, and make their
Mm-hmm.
exams better. So yes, I think it's a great, and it's not an expensive book. Like it's very, very affordable,
Mm-hmm.
especially for students, right?
Yeah, and that was the whole point, is really, if you read the disclaimer, and that's why it's called a clinician's guide. It's not a layman's guide at all, because I built it on the premise that you know anatomy, you know physiology, you know, your basics are there. So it's really targeted towards the animal, the vet techs, the veterinarians, the animal physical therapists, and anybody else who has an animal certification, who has already done the basis. And that's why I say it's not a textbook. It's like I dive straight into it. There's no foreplay. We just go right in there and get to it, because that's the whole reason. Is it's not for the layman. It's not for the vet owner, the
Mhm.
dog owner. It's really for people who are in the field, who are looking for a reference book, who want to know more, and really the course that Dr. Matt Brunke and I are designing, which is going to be released at the end of the year, is based on the book. And it's one of those things that, honestly, having hands-on training in this is really a defining moment, because I'm very privileged that my husband's been an acupuncturist and a dry needler for 25 years. So I get some in-home work once in a blue moon, shoemaker's sons are never shod. But
Yeah.
it's changed the way that my life works, because without it, I don't think either of us would survive. But it's one of those things that there's many different mechanisms. There's lots of different training. I am very... I believe in local twitch responses. I believe in eliciting twitch responses to get the desired outcome that you're looking for. Otherwise, really, you're just doing acupuncture, because there's a
Hmm.
huge difference between acupuncture and dry needling. It's like, and I'm a TCM-based acupuncturist, so it's very, very, very different. And this has always been my biggest point when I'm treating or I'm teaching is, what is your goal? What is it that you're looking for as an outcome? And if you're trying to get rid of a myofascial trigger point, yes, with TCM, we talk about sheep points and all of those sorts of painful points, which are effectively myofascial trigger points. But the needling technique is very, very different.
For sure.
And your outcome is different,
Yeah. And I mean, so I've had dry needling once. It's funny because I remember she pulled the needle out, and I mean, I use like 0.12s, 0.14s, sometimes 0.2s on dogs. And I think she pulled out a 0.3, and I was like, holy cow, you're gonna stick that in my arm? And she was like, yeah. And I was like, that's like a horse size. And she was like, no, it's not that long. I'm like, I don't mean the length, I mean like the diameter. And she took a month and a half to convince me that this was okay, this was a good idea, because I was like, if I pass out, I'm gonna kill you. And so she did it. I felt nothing, and I was fine. But I'm like, I put needles in dogs all day long. That's what I do for a living. And I was like horrified that that was going to happen to me. So I know there's clients we have to manage because they have needle
Mm-hmm.
phobias. But some of these dogs, like you said in your book, these are painful things to deactivate, right?
Mm-hmm.
And so,
Yeah.
do you ever muzzle them to do
Nope.
it, or do you ever sedate them to do it? You
Nope.
don't,
Nope.
and they're fine with it.
Yep. animals are amazing because they get such a sense, and Danny, you've been in practice for a long time. They know if you know what you're doing, and they have a very clear sense about what you're doing. And if you have confidence, like energetically, I really do believe they read our minds, because I know when I think I should take my dogs for a walk, they sit by the door and wait for their collars to go on. And so, I think a lot is, and in acupuncture, especially in TCM, we talk about intention. And I do believe that a lot of what we do in the veterinary world comes down to intention. I have never had to muzzle a dog to needle it. In fact, I don't believe in that, really. I think that there are many ways to, I always get my idioms wrong. I was going to say skin a cat, but I don't think that's right. But there are many ways.
It might be. There's many ways to skin it. It's a horrible idiom.
That's horrible.
Like, we'll just cancel that.
You know what I mean, though. There are many ways to achieve your outcome. And that's why in the book, I really do go towards like what you can do within your scope of practice. So if you can stick a needle in something and you know how to do it correctly, effectively, and you've been trained in that, then by all means, go for it. And you feel comfortable and confident enough to do it. If laser or extracorporeal shockwave is in your wheelhouse, fantastic. Use that. If you just want to, if you're a manual therapist and you want to do some ART and myofascial release or acupressure, phenomenal. Your results are going to be very, very similar. One may take slightly longer than the other, but that doesn't mean that you cannot be incredibly effective just using these.
Right, totally. Exactly. And I do use these a lot. And I mean, we've never dry needled, I don't think, maybe a couple times. But primarily acupuncture, laser, we do massage, we do some manual therapies, we do rehab and stretching and all of these other modalities.
Mm-hmm.
But, I read your book and then I'm like, again, my mind is like, we can always do more.
Mm-hmm.
Right? And shockwave's always in the back head. Do you, or did you, where you were, have, what kind of shockwave did you have? Did you have radio or did you have extra
I had
corporeal?
focal. I
Yeah.
had focal shockwave.
And they tolerated it okay?
Beautifully. You just change your head really so that you're using an acupuncture-based head. And they do great. They really do great. Yeah.
And did you have what kind of laser did you have? 3B?
3B. Yep. So, and I find that very effective too.
Do you have one at home too? Yeah, totally. Well, we don't have a class 4 in the clinic. We have a class 3. We have 2 class 3Bs. I like them better. And again, my appointments are half an hour to an hour anyways, so I can take the time to maybe spend more time lasering as opposed to a quick class 4, wave it over the joint, and they're in and out. In regular practice, it was a little appointment times are shorter and you might be under, a bit of a time crunch. But I do like my 3Bs and I find that they get really, really good results. So.
Well, and if you look at some of the photobiomodulation research, people, they even get great results with 2s, especially for myofascial type stuff. They really do. It takes longer, different techniques, all of that. Personally, I haven't used a class 4 laser just because I'm a little bit of a safety Nazi, and I just have a little bit of concern about it just because it's not in my wheelhouse and it's not something I'm familiar with. It's not that I have an issue. And if you're trading that, great. The one thing we have to remember about myofascial is that it's very plastic too, and that it changes very, very quickly. So, all these different techniques create a different cascade, especially if we can bypass the spinal reflex arc and get a ton of ATP in there, which is going to help release sarcomeres and change the end plate noise and the actual reactivity of the muscle. And that's really what we're trying to achieve. So however you want to do that, that's totally fine. You just have to understand really what you're doing and why. The why is always the big one.
Well, I do think every vet should have this book. Like, I really, really do. I mean, I think as it is, we're trying to improve the awareness of veterinarians about rehab and what it does, and the fact that it's not just post-operative TPLOs that we're rehabbing, but we are rehabbing, which involves all of this, right? It involves your therapeutic exercises, your water therapy, your myofascial treatments, and laser, and all of those things for senior patients, for neurologic
Mhm.
patients, for conservative management of patients. And I think this just gives them another tool to read, and it's such an easy read, Michelle. Um, for them to have on our shelf to remind them that maybe if that range of motion seems normal, maybe there's something else they should be looking for in that lameness and not just thinking it's a random soft tissue injury and dispensing NSAIDs, right? I think
Mhm.
it's fantastic. Mm-hmm.
Thank you. I really appreciate that. Thanks.
Very welcome. I know Lisa asked if how they get a copy. I got mine on Amazon. Is there a
Mhm.
preferred? Is that where you were sending people?
Amazon, or if you just go to my website, which is Dr. Michelle B with one L.
So for those,
Yeah, there you go.
that's it. A clinician's guide to myofascial pain in the canine patient. It's Dr. Broadhurst, and if you look for that on Amazon, it is there. Um, so I would highly, highly recommend that you pick a copy up. Um, Even if you have it to kind of gradually peruse through it and then have those as a reference, it's fantastic.
Thank you so much. I appreciate it.
Good job. I look forward to the horse one. I don't even do horses,
It's going to be quite fun because it's a
but
little
I'm probably going
different.
to buy it.
Well, especially because
Yeah,
your
is
daughter
it?
rides. So yeah, it's
Yeah.
similar in a lot of ways, but it's a little different in that I go a little bit more in depth. Canines generally. I wasn't going to go into the world of duck diving and agility and all of those different disciplines. In the horse world, it's a little bit different because the specific disciplines have got a lot of very specific issues that go along with them because of like the way they go around a track is always like one-sided. So and cart pulling and polo versus jumping versus all of this. So there's quite a lot in that about that, and looking for specific things in specific disciplines and specific injuries. And so it's a little bigger, but it's very similar, and very excited to actually get that out because I think it's going to be a great one.
Do you know when
And
it's being released, Michelle?
end of August, so beginning of September. Yeah, it'll be on Amazon.
There you go, Lori. End of August. Someone asked. So that's good. That's fantastic. That's
Wow.
soon.
Yeah, it's around the corner. So yeah, it's exciting, and one of the things that we've talked about quite extensively is all of these things are in different people's wheelhouses. And I was blessed that I lived in South Africa and I had a lot more leniency as to what I could do litigiously. So I was very blessed that I've got the experience that I have. And I'm so happy to share it with all of you. But, the integrativeness that I foresee, and I'm really hoping and praying is going to happen in the very near future between all of the different disciplines. That's one of the reasons why I also wanted to write the book, is like, wouldn't it be amazing if we could all sit around a table and discuss a problem patient, and you've got your physical therapist and your chiropractor and your acupuncturist and your veterinarian and your lameness specialist, and we just shoot off ideas and we all go and look at different things and we figure it out and the animal gets better and we're all heroes. Wow.
Right? Right. Yeah, I agree. And it's funny because so if you'd asked me if I'd ever have this conversation probably with a chiropractor, I probably would have thought probably not. Um, and the reason is I have never had a good chiro experience myself. I
Mhm.
think I've been to three in my lifetime. Every single time it was not a very good experience for me. Um, but I read your book and it's not anything I've ever experienced, right? No one ever treated me how I think you treat patients reading this book. Does that make sense? I felt like it was very,
Totally.
yeah, it was very, I mean, I've been to an osteopath and felt that. But yeah, chiro, not as much. And you have said this, there are amazing professionals in each group of professions. And then there's others that maybe aren't at, don't practice the same way. And so, you know, it's hard not to bias your own opinion,
Mhm.
but that shouldn't stop us from finding the good ones and all working together because we're there, right?
100%. And you know, that's why I'm very proud to be a South African chiropractor, because we got trained very holistically with a whole bunch of other things in our arsenal that we could use in practice. So we were trained in a way with chiropractic, very straight chiropractic adjustments, but with a ton of an osteopathic side. So looking from nutrition to myofascial, like I started learning myofascial dry needling in my third year of university. So I feel, you know, really
Wow.
privileged that I got such a functional neurology base. And that's really what I do work my practice on is, yes, of course, I palpate every joint. I'm looking for hypermobility, but it's not just that. And that's one of the things that we need to look at when we're looking at integrative care in medicine is like, I was talking with a vet this morning and I was saying, you know, I kind of, I love being a chiropractor. I love chiropractic. I love what I can achieve, but I'm really more along the lines of doing functional neurology, because when I'm looking at a lameness, yep, I'm checking the back. Okay, we have an issue. We got a bit of a dysfunction at like L3, L4. Great. Okay, but let's watch that dog move. Okay, how's their gait? We've got like a grade 1, grade 2 lameness. That's interesting on that off, you know, that right hind leg, for example. Okay, so we're going to check the tonality of the quad. We're going to look at the patellar reflex. We're going to go through the neurological pathways, check CPs, look at superficial and deep pain, all of those things, because what am I actually treating? I'm not treating the joint. The joint is potentially a causative factor, but I'm treating nerves. And I always talk about the hosepipe analogy whenever I teach, is that the central nervous system, which is your brain, is the tap that you switch on to get your water to flow, right? You've just planted your beautiful garden. You're so excited. You want all these pretty flowers. And now you're going to stand on your hose pipe and there's going to be no water coming out of that hose. And you're wondering why your flowers die. Now, is it the flowers' fault? Because that's where we're looking. It's the flowers' fault. It's not the flowers. It's the fact that neurologically, we're not getting where we're going. And the pain cascades are exactly the same. So if you look at ascending and descending pain pathways, when we're looking at the serotonin and the endorphins releases in the descending pathways, really what we're doing is we're changing the plasticity of the brain. We're changing the neural pathways so that we can actually get that to a point where the neurology is competent enough to actually go and feed your flowers, and the flowers were never the problem in the first place.
Yes. That's a great analogy. I like it.
You can use that. You can all
I
use
will.
that.
I actually probably will. Yeah.
It really makes patients, you know, when I talk to clients about neurology, it really helps them to understand that, because it's something that they can envision in their mind. If I'm saying to them, well, we have a little bit of a nerve root entrapment at L3 and L3 goes to feed this, this, and this, I've lost them. They're like, she said something about L. I don't know who L is. Who's L? And why
It's
is he
all about
free? And I don't
communication,
understand.
right? She wants tea. I don't know. Yeah.
Weird South African girl.
It's the accent. I don't understand a word
Yeah,
she's saying.
foreign. I'm foreign, sorry. So yeah, and I mean, making patients understand that also gives them like, oh, okay, nerves are tricky. Nerves heal slowly. I'm going to give this a go because I really want my dog to use its leg effectively and not have a disuse atrophy. And I now get that we've been standing on the hosepipe. Cool.
Right. So,
You know,
so for those of you who don't know, Ontario College of Veterinarians is passing, if they may have already passed, although I think it's still being finalized. Some legislation regarding safety in veterinary medicine. So laser therapy is on the list. Shockwave is on the list. It is a very long document. I think Laurie Hughes had it up on her site. If you want access to it, you can read it. The idea is that they classed all of these different potential modalities and then said class 4, class 3B lasers and shockwave are, well, shockwave wasn't even the most dangerous. Class 3B and class 4 lasers were considered dangerous and only should be used by veterinarians or direct supervision of veterinarians. So those of you who have been watching can clearly see that Dr. Broadhurst is intelligent, she's trained, she teaches, she has so much education on laser and all of these modalities. And so for her to be restricted to use these devices doesn't seem right. So physiotherapists, technicians, chiros, they're all upset about not being able to use these on animals, which is understandable because a lot of them have practices where laser is a huge part of that. I think the concern from my standpoint as a veterinarian, and it doesn't really impact me as much because I am a veterinarian and I use laser in my practice and my technicians use the laser in our practice. But as a referral, so when I was in general practice, for sure, if one of my patients went to a chiropractor, although the chiropractors are regulated a little bit differently in Ontario, but a physiotherapist, say, or a technician owned a business and something went bad, that dog got aspiration pneumonia in the pool or got burned by the laser or they lasered over a cancer site or something like that, I'm the one that's liable. And so my conversation with the college, that why can't we change that, right? It seems to me to be I mean, I understand partly because there are a lot of non-certified, educated individuals purchasing class 4 lasers, class 3B, but class 4 as well, and then treating animals. And so I had called the college, this was a long, long, long time ago, and said, this cannot be right. I think she was calling herself a physiotherapist and she was not. And they said, there's nothing we can do because she's not a vet and vets are the ones we regulate. So that's kind of, I think, been moving things along. I agree that we need to either grandfather those in who are certified or make some sort of like alteration in that regulation to make sure that they are covered. But I think the liability for veterinarians referring is a big deal. And I do remember talking to a chiropractor, and again, this is on vets too, not knowing who to refer to and feeling comfortable with their education on things. But I talked to this chiropractor, and again, she adjusted me and it didn't go well. So it's probably not someone I would have referred to anyways. But she was lasering these dogs and she was seeing them without referral. And I said, but that bothers me because I have a laser. And so you're seeing my patient and lasering them, and you don't have a referral, you have no medical records. You know, we as veterinarians make sure we don't treat without medical records from another veterinarian to make sure that we are getting all the information. And she said, if I ask and make a referral mandatory, the vet probably won't refer to me, and then these patients will go without treatment. And so that is why I don't ask for one. So that's my story.
So let me give you a little bit of history in the chiropractic world. So here in the US, and one of the reasons why I moved to Colorado was that they are the only state that currently doesn't, you have to go through a whole training process. Obviously, you've got to do a minimum of 210 hours, I believe, through a certified college to be an animal chiropractor. You need to either be a chiropractor or a vet to go through the studies. I'm certified with the IVCA. There's the AVCA certification too, which is the American Veterinary Chiropractic Association. But up until 2 or 3 years ago, and every other state is like this still, you need to have veterinary referral in order to adjust an animal. So in Colorado, they changed that you had to do another certification to be able to see dogs without a referral. I honestly love getting vet referrals because it gives me the whole picture. Otherwise, for me, I'm getting, I don't think it's always 100% necessary, but it's very nice because it does two things. It integrates. So you know what I'm doing. I know what you're doing. We're all on the same page. Right. I don't have hearsay. I don't have a person saying, my dog is on Adequan, but he's actually on Apoquel, or my dog's on gabapentin, but he's actually on glucosamine. And I'm writing down, oh, the dog's under complete pain control. This is awesome. I'm so excited.
Why is he so painful if he's on all these drugs?
Exactly, right? So yeah. The one thing that I think is really important is that no one's trying to take anything away from anybody. I don't think that should be and sometimes that is with certain practitioners, that they want to keep everything in their own wheelhouse. I think what you were just saying is 100% right, is that having liability insurance, being certified under a board that ensures that you're sticking and complying with your scope of practice and your abilities, and potentially modifying that. So I'm one of 4 chiropractors in the world who have a CCRP. And that makes it really difficult because my scope of practice is not inclusive of that, but I have all this stuff and I've done all this stuff and all of these are different things, but that's irrespective. So my point is I think where it comes down to is, what training have you received? Are you a danger? So if you've gone through the CRI program or CCRP or the other ones that I never remember, and you've had the education and you have the knowledge, and I just never remember them. No offense, just
the Healing Oasis is the other one, I think.
There you go. There's another one. Or the Chi Institute. I think they're doing stuff too. Like whatever it is, if it's recognizable as a proficient, really good rehab certification, you have the veterinary knowledge behind you, you've done your hours as a veterinary physical therapist, for example, great. There is no reason why you shouldn't be allowed to use those modalities, because you're using them in a safe and effective way. And I think exactly what you're saying is that the liability needs to be on the practitioner. It doesn't matter if they're a tech, that's on them. It's on my license. If I screw up, it's on my license. It's not on a veterinarian's license. And nor should it be, because you may not even know that the dog's being seen by anybody else, but yet it's still your patient. So your liability is such, and that's not fair. I think the biggest thing is competency, education, ensuring that it actually does get, that all the boxes are ticked, because all of these modalities are hugely helpful. And I mean, yes, I'm very much a manual therapist, but I do, when the occasion arises, it's lovely to have. But if you are certified and you are safe and you know how to use this and not damage the animal, you know your indications and your contraindications, there's no reason why trained professionals shouldn't be using that, irrespective of what letters they have behind their name.
Mm-hmm. And the thing is, I think there's a false sense of security on training with laser, right? I mean, I know Companion's a big one up here, and they're like, yeah, we'll train you. I'm like, but is that enough? Because I don't think it is, because we see a ton of complications from laser coming in from people who think that they're using it properly. And that scares me, right? And that is a safety issue, right? I really, really actually wish we had a physio on here, because I feel like they have some good input too. And, there's a lot of physios out there that are doing a great job. And 100%. I feel like we need to work together and support one another. And I just feel like the more stuff like this happens, the more pushback there is. They're like, we don't need vets. We don't want to talk to them. they're just trying to control everything, whatever the case may be. And I think we need to look at the whole picture. And I feel like that's being missed.
I think you're right. And I think maybe it would be a good idea, especially in your province, to have a board of people who are specializing in rehab, because my gripe too, And this is not like I say, there are amazingly wonderful people in every profession, but just because you have DVM behind your name doesn't mean that you know squat about laser. I'm not talking about you, but I know I've been in vet clinics where they've just bought one and the techs just screw around on it and laser dogs after. And I was like, I was actually working in this vet clinic at the time, and I was like, what are you doing? I have no idea.
You hit the button. Yeah. Mm-hmm.
And I'm like, do you even know what setting you're on? Nope. So there's that side of it too, is that there's almost a little bit too much leeway in the veterinary profession, that when you have DVM behind your name, you can now do anything. I've seen really bad repercussions with certain vets adjusting and really serious, like, breaks and fractures and nerve root entrapments that have resulted, and just because they weren't trained. I'm not saying they can't, and training is important, certification is important, education is there not just to, everyone thinks, oh, they're just trying to make money. It's really not. If you don't understand the principles of what you're doing and why, and what the contraindications and the precautions should be, you're in a bit of trouble. And it works both ways. If you have the ability and the knowledge behind you, fantastic. But there's a lot of professionals out there who are doing stuff that they have no business doing because they have no idea why they're doing it. But it just seems like a nice idea and we can bill for it. So
yeah. Right. Agreed. And I mean, one of the reasons I left where I was when I was started doing rehab was I made good salary as an associate veterinarian, and to justify me, in a laser appointment for half an hour with a class 3B didn't make financial sense to him, right? Again, looking back, it does, because you draw in so much more client trust and everything else that goes along with these appointments. But that's an aside. If you look at just plain laser, so the goal was for me to pass that off to kennel staff, right, to operate this 3B laser. And I remember looking back, especially, you would hear complaints, yeah, he was really sore after, or he was really sore the next day. And I'm like, because I don't think that they knew or had the ability to know clearly. These kids didn't have any training. They just hit the buttons and press start and treated where we told them to treat. Again, do they even know where that joint is? Are they actually pointing it where they need to be pointing it? And I feel like there's just more, like you said, regulation that needs to happen. And do I think that regular vet clinics should have laser? Yes, but I agree that we need to do far more training than having someone who sells the lasers come in and say how wonderful it is, right?
Well, and this is always the thing, is like, I don't believe that just because you've studied something that you're the be all and end all of everything. So, maybe it would be a great idea for you to sit down with Lori and a bunch of others and really like write something up, because it has to be a tiered process of these people have the certifications, they have the education, they know what they're doing. There's no reason they are not the ones that are hurting the animals.
No, exactly.
And I think that the veterinary colleges and hopefully you guys will be setting precedent for the rest of the world, actually, and going, okay, cool. So we recognize the fact that you have this amazing ability and this amazing certification. You've got all this knowledge. You're completely safe. Why would we not let you use it? But an uncertified DVM can just purchase a class 4 laser and go to town and burn the crap out of a joint. Like, and you know what I'm just saying? Like, playing devil's advocate.
Well, and I'll guarantee
I think
you most of the DVMs are doing it, right? They're still passing those off to their technicians, right?
Well, and the problem is that the technicians don't know either, right? So and then it's just a complication of the surgery, or so like what you're now getting, you're getting the problems that were caused by others, right? So I think for everybody involved, including owners,
So I had a call from a young physiotherapist in our area. She's been out for 4 years or something. She sent me a message saying she really would like to learn more about the animal rehab division so she could get certified as a um, rehabilitation practitioner as well. And she doesn't want to give up her human side of stuff, but wants both. And so I called her and we had the best conversation today. Again, bright girl. I didn't realize that PTAs were similar sometimes to the vet techs that they have in practice that may or may not have gone to school, but are completely trained on the job. And so she said, again, it's her entire liability if that PTA does something and something goes drastically wrong, right? So we learned a lot from each other. Again, it's learning from each other today. And I encouraged her. I said, I think the animal rehab division for the CPA does an amazing job. Lori does a lot of the courses, but there's a ton of information and it's extremely thorough. If you go through the whole process, right? But it's the same thing with the CCRP program or the one out of Florida or the Healing Oasis. If you do 2 of those courses, should you be practicing? I think there's merit to finishing the whole process, doing your exams, doing your case studies, and going through it because you earn that. And once you've earned that, then yes, I think you earn the right to be able to practice and be part of this whole industry, this wonderful, wonderful industry. I still think we have so much to learn from one another. And she said, well, what would you recommend one over the other? And I said, I think it's individual. And I said, the CPA program seems to be fantastic. I said the one thing would gain from doing the one in Tennessee is this, right? This collaboration with other professionals. So chiros, physios, and PTs all talking from different points of view. And when we go down and do your clinical work, I think that's what you would miss if you were just, because I think, and I don't know because I'm not a PT and I haven't done that program, and maybe Lori could pipe in, but I think that's what's missed is their input from other professionals. If that makes sense.
Well, and again, I think integrative care is really the only way that building a tribe. I've talked about this over and over again, is like we all have different skill sets and we all have phenomenal skill sets. If we can integrate together, that's really where the patient wins. And and we all do come from different places, and there's no right real way to do rehab. That's what I love about it, is like there's a million different things that you can do, but you need to know what is used for what and what is applicable at certain times and all of those sorts of things. And I think that's what education really gives you. So I don't think that anybody should be working uncertified. I think it's irresponsible. And I know I get a lot of backlash from chiropractors when I say this, because they're like, we're chiropractors, we can adjust everything. Well, no, you can't, because you never learned a dog's anatomy at school unless you went to animal chiropractic school. So, we have these courses, we have these incredible tools around us that we can use and go to these phenomenal courses and learn a new skill and apply it. It's really, for me, it's just irresponsible to pick up a laser or start adjusting a dog or start rehabbing with exercises that you looked at on YouTube when you don't really understand the full picture. Again, it's like having all your puzzle pieces, you can finish the puzzle. If you have 20 pieces of a 1,000-piece puzzle, you're not going to get very far. So I really think that infighting just separates us all. And I don't think that anybody owns rehabilitation or physical therapy. And I had to laugh the other day because somebody said to me, oh my goodness, this person can't call themselves an animal chiropractor. They're a vet. They must call themselves a spinal manipulator or something. And I'm like, seriously? Like,
it's legal terminology.
Seriously? I know. Like, this is just ridiculous. So when I'm taking a dog over Cavalletti's, I can't call it physical therapy. I must call it rehab or exercise training or wellness enhancement. I don't know. Or the monkey in the back room. I don't know. I just think we've got to really focus on what matters and what's important. And the important thing is making sure that the right people with the right education are doing things correctly. I don't think this should be about taking away modalities, taking away specific techniques. You know, I know people who are physical therapists who are doing grade 4 and 5 mobilizations and 5 mobilizations, which are adjustments. I'm not going to report them to the board and say that they're doing animal chiropractic. If they have the knowledge and the tools to do it, please, and the dog's getting better, go for it. This is about ego. A lot of the time,
Yes,
a lot of what we're going
from
through is
all
about
different
ego.
aspects. Yeah. And
And we
Lori did
actually
so.
have to put that aside.
Yeah, 100%. Lori mentioned that they do 20 to 40 hours of vet shadowing, which is fantastic. To get the physios educated in the fact that there's so much of vet medicine that they don't know. And she agrees they need to finish their training, because I think, and I've met CCRPs who didn't finish their CCRP, right? They did all the online stuff, but then they never actually went and did their hands-on stuff, or they never went and did their final exams, or they never finished their case studies. And I think there's something about going through that process. And again, I did all of that. And I remember graduating. And so by then, that was 2013. So I'd been out for 11 years, right? Practicing as a veterinarian. So I kind of was finally at the point where, again, I had my second, I don't know anything, and I was starting to feel a little bit better again. And you graduate from your CCRP and you sit there and you're like, how do I do this? Right? Like, you have the knowledge there, but I think collaboration is such a big thing. There's enough of us now, especially locally. We've been trying to reach out and talk to other rehab practitioners in the area, because I think case sharing and case discussions, and I know the Facebook site that Tara Edwards started is a fantastic resource it's a Canadian animal rehab group, just for us to share cases and get other people's inputs. There's physios, there's text that's on there. I think, again, we've talked about practicing on an island. I know Dr. Sholin and I have talked about that. Megan's talked about that. We need to stop it, right? I mean, even as a veterinarian, when I was in regular practice, when you were on your own, it was a very different feel. You practice very different than if you have other doctors in the practice to say, you know what, can we just go over this case because it's kind of weird and I want to make sure I'm not missing something? Like, holy hell, if we could get together as practitioners, if I could get that PT that's nearby to say, hey, is there anything you would add? Because I think I'm at a point where I can't do anything more for this dog. What do you think? Like, can you imagine if we could come together and stop being like, well, what if they steal my business, right? Or what if they do this, or what if they do that? Like, we need to get off our high horses and just try and work together. That's
and I think
process.
That's exactly
but
that's
the liability is a big deal too. So we need to also try and work towards changing the legislation.
And I think my understanding is I have malpractice insurance as an animal chiropractor and as a human chiropractor. I don't understand why they are that the liability would be on you. That doesn't make sense to me, because you as the individual practitioner should be responsible for your patients and your care. So they need to change, right. Like that is actually where the addressing needs to be, is like, that's the first step, is like, let's make everyone accountable. Because if you're certified and you know that you know what you're doing, the chances of you doing something outside of the parameters which you should be treating in are nothing. And then just instilling like, these are the certifications that we recognize. If you've done this, then go to, have a ball, go do your thing. But limiting scopes of practice is never going to integrate. It's just going to divide.
And I think we all have liability insurance. It's our college's mandate that if something goes wrong, ultimately, we're the ones responsible. So So
It's
if the
crazy.
owner were to say, where do I complain? The answer would be, it's the vet's fault. It's the vet's fault who referred it. And that's what needs to change. And in
Hmm.
addition to that, you have technicians. I don't know what it's like in the States. In Ontario, um, there's technicians who either don't write their exams because they don't have to practice.
That's
But if they
weird.
don't write their exams or they don't maintain their exam, paying and their dues to the OAVT, they can still practice. Should they? I don't know, because you can also do technician work within a practice and not be a technician. So it's such a fuzzy area, but maybe
Hmm.
what they need to say is, if you're going to be a rehab practitioner and you're going to own your own business and you're going to have a laser, then you need to have your R and you need
Hmm.
to pay into the OAVT, because then the OAVT will regulate you.
Yeah.
Or we have some sort of organization that regulates all rehab practitioners, whether it's vets
Hmm.
or physios or chiros or whoever is doing it, that if something goes wrong, then they are held liable by that organization. Like, that's the ideal, right?
And I think if you get together with the people who are really
Or if we need to make
spearheading.
one, all of us get together and we say, hey, let's do it, right?
No, and seriously, I think
I don't know.
that's the
I
way to do it. There's power in numbers, and I don't think anyone's trying to take anything away from anyone. I mean, Danielle, you've said to me yourself, you're so overwhelmed, you're so busy, you can't even like stand up straight. Um, so no one's worried about taking that. There's not enough patients. This isn't about a pissing contest. This is
right.
about just allowing everybody to work with confidence in the confines of what they do, creating a place where it's safe for you as a practitioner
1050.
to work with other people. And maybe
Mm-hmm.
that's exactly what you need to do. Maybe you guys need to get together and draft a letter saying, as a community, this is what we're proposing, and get as many vets
Yeah.
and physical therapists and CBTs and or everyone on board to go, we want to work together. This is driving us apart. Nobody owns this. Nobody has
Right.
rights to this. But
Yeah.
you do need to have this level of education so that we know that you are capable.
Yeah. Absolutely. Agreed. So we're heading on to the hour, Michelle. It went
Alrighty. Thank
fast.
you for having me.
You're very welcome. Thank you for coming out. I am now on a vacation, so I'm
Oh,
gonna go
that's the best
relax.
time.
I know,
Yes,
a
go
week
have a
off.
glass of wine.
Yes.
Nice.
Thank you. And I'm sure there will be more conversation to be had. And if you want Michelle's book, I highly, highly, highly recommend
Thank you.
it. You can get it on Amazon. Just look for her name, and I'm sure it will come up at the top. So, all right,
Cool. Thanks.
everybody, have a good night. Have a great
Bye.
weekend.